Okay, children, it's 9:50. We're waiting for the next agenda, which is 10 o'clock, COVID-19 update. Dustin Molly. So we have somebody on the phone, and this is another thing they do. Usually they'll ask who called in so they can put the name up on Zoom meetings held by other groups. We have Granite Health, Maria Stopler, and Jennifer Robinson. These are the three that I know of that are associated with health in this county. I'll ask them the question. That's a good idea. morning. How are you? I hope you were just ringing on for a checkup. Question. I kind of before the I hung up with it's crazy how they call it. I don't know. It's something like really upset what they did, and it was
Okay. Okay, we're back in session. This is the time set for a COVID-19 update, the incident management team report. Dustin, are you on?
I am. Yep, I'm here. Good morning.
Good morning. Take it away.
All right. Granite County is down to 8 active cases as of yesterday, so that's good. It's a much lower number than we've seen previously. The state reported 859 new cases for today, with 763 total deaths. Yeah, our numbers are good. It seems like people are starting to really follow the guidelines. I know I've been in the grocery store a couple times in the past few weeks, and it seems like everybody's masked up. So I think that definitely contributes to it. We're still kind of in a holding pattern, waiting to see what the fallout from Thanksgiving will be, but hopefully the numbers will stay low. As far as the CDC rolled out some new guidelines for quarantine last week. Debbie and the rest of the health department has been discussing it and working out the best guidelines for our jurisdiction here. And she's come up with some stuff that I think should be pretty beneficial for folks that are exposed or positive. I'll just kind of briefly go over the new guidelines. So basically, if you're a positive case, are you there?
Yeah, he said he's going to go over right now. Go ahead. Yeah, go ahead, Dustin.
Okay. So if you're a if you test positive, your quarantine will only be 10 days as opposed to 14, or 12 days as opposed to 14. After day 10, if you have no signs or symptoms on day 11, then you can be off on day 12. So that's a few days less than we had before. And as far as contacts go, if you're exposed to somebody that has tested positive and you're a close contact, if you get a test on day 5, you can get off on day 7 if you have no signs or symptoms. So that halves the amount of. Go ahead.
And if you're negative, if the test is negative.
If the test is negative, yeah. If you have a negative test on day 5, you can get off on day 7. And we are only using the PCR test, the nasal swabs, not the rapid test for that. The rapid tests just have too many false negatives. So Debbie decided just to use the PCR tests for that 7-day. And then if you don't get a test, if you decide not to get one at all, you can be off on day 10 if you have no signs or symptoms. Any questions about that?
Yeah, I got a question, Dustin.
Yeah.
With the delays we've seen in getting testing results, that could be a complication in here, don't you think?
Yeah, there has been several periods where it's taken longer than 2 days to get a test result, but hopefully we can work around that. I mean, on average, it's been relatively quick. It's just when the state gets backlogged, it does take more time, but we'll just have to have people be patient and hold on. And hopefully most of them will come back within 2 days so we can get these people off and back to work and school within 7 days.
My daughter's so just remind us once again, what are the implications if somebody gets notified that they've been in close contact, they go and get a test on day 5, and they don't get their test results back until after day 7, then they're still free to go about their business on day 10? Even if they haven't got a result back? Okay.
If they have no signs or symptoms, yeah.
All right.
And they will be quarantined. The health department will call them every day. We'll do contact tracing with them. And they will be in quarantine, until the test results come back or day 10.
All right. Thank you, Dustin.
Yep. And getting that test on day 5 is really key. It gives the virus a little bit of time to work itself through and make sure that if you are positive, it will show on a test. So I know a lot of people have gone in to get tests right after they've been exposed, and we're finding that that's just not adequate. It needs 5 days to work through your body and inoculate and whatnot.
It takes 5 days to come. That's it. Is that what you're saying?
Yeah. Yep. It takes 5 days to guarantee that test result is accurate. And it's still not a guarantee, but it just makes it a lot more accurate.
Yeah, there's people that are testing negative at 2 days, and then at 5 days they're testing positive. And it's due to the same exposure. So they're just giving the virus more time to infect the person so they think they're truly infected until they do the test. Does that make sense?
Yep. Any other questions on that? All right. Well, my next portion here is the vaccine. The state has received and is waiting to start distributing the Pfizer vaccine. They're hoping to start distributing it on the 13th, so 5 days from now. They got about 10,000 doses. The Pfizer vaccine is the one that has to be stored at super negative temperatures. Basically, they're going to parcel it out to the 10 most in need jurisdictions. it comes in doses. It comes in batches of 750 doses. They can't really be broken up. They need to be administered within a couple hours of receiving it. And basically, the bigger hospitals and jurisdictions in our state will get those first. But then on the 18th, the state's going to start distributing the Moderna vaccine, which is the one that can be kept at normal freezer temperatures. They're hoping to distribute 20,000 doses on the first week, starting on the 18th. And then they're hoping to have 60,000 doses distributed by the end of the month. Our hospital, Granite County Medical Center, has enrolled and been accepted as they'll be receiving it as soon as they can. Hopefully it'll be within the first week or so. And basically they'll be vaccinating the healthcare workers, the frontline workers, and the long-term care patients and residents first. That'll be phase 1A. And then phase 1B, as soon as that's all taken care of, it'll be other critical workers. So sheriff, anybody else that's, critical worker. And then hopefully phase 2 of the vaccine will be starting to get rolled out around the first of the year. And that's going to be population of 65 and over, or anybody with underlying health conditions. And then phase 3 will be the general population, and they're hoping to have that rolled out by early spring. And the state's going to have a weekly conference call strictly on vaccines and distribution here. They started last week, so we'll have another meeting on Thursday, and hopefully there'll be some more updated information for next week. And that's about all I have right now. Any other questions on the vaccine rollout?
How many did the hospital try to get? Will they use them down in Drummond too? Clinic?
Yeah, well, the health department will have some available as well. Debbie's not exactly sure. I know previously there's, I think it was with the SARS vaccine that they had, the smaller jurisdictions didn't get a whole lot right away, but they come in batches of 100 doses. So hopefully we'll get at least one of those batches. And the first, the phase 1A will definitely be the hospital, the healthcare workers, possibly Debbie and Jackie, the public health workers as well. And then all the residents up at the long-term care facility. That's their primary goal, is to get that, just because there has been so many outbreaks in long-term care facilities that have been pretty devastating. So, and once they can get the hospital vaccinated, they'll move on to the phase 1B, which is the other critical workers. And the vaccine it is a 2-dose vaccine. So
are they going to charge them shots? No, these are all free? Because I heard different.
Yeah. Yeah, all the insurance companies will pay for it, and if there's a situation where somebody's not insured, the state is supposed to cover it. It's not supposed to be you're not supposed to charge for it. So, and it is a 2-dose vaccine. So the first people that will get it, they'll have to go back about a month later and get a second one. And the state will send that second dose separately. So everything we get in the first round will be used on the first round. And then a month later, they'll send another batch for the second round.
Can you explain the phases again, just real quick?
Could you go over the phases again real quick?
Yeah. Phase 1A is what we're going to be rolling out in the next couple of weeks. And that's healthcare workers, frontline healthcare workers, long-term care residents, and the workers that work with them as well. So all the food and housekeeping, anybody that's in there at all. That's phase 1A. Phase 1B is other critical workers, sheriff, city, stuff like that. There is a phase 1C and D, but they were relatively convoluted. And I think they're still kind of working out exactly who will fall into those categories. But then phase 2 is the population of 65 with ages 65 and older and people that have any underlying health conditions. And they're hoping to start that, around mid-January, sometime the first of the year. They'll hopefully start phase 2. And then phase 3 will be the general population. And they're hoping to roll that out by early spring.
Any other questions of Dustin?
No, I guess even Missoula County just sent a thing out that, it'd be several months for the other ones to get it.
Can you get the vaccine if maybe you had the virus and didn't know it and have the antibodies? Can you still get that vaccine?
Yeah. As far as I know, you can. A lot of the details are still getting worked out. The CDC did put out I'm not sure if you guys saw the HAN message that I sent out on Monday, but they did give some resources for reinfection. Basically, if you've had it once, from the date that you tested positive for 3 months, you won't be considered a close contact if you're exposed to somebody that's positive. So they're giving people a 3-month window after the first time they test positive. But they are saying after 3 months, you could potentially be susceptible to catching it again. So there has been quite a few cases documented of people getting it twice now.
Question about side effects of the vaccine.
Did they
Sorry, Blaine, what was that?
Did they send you any information about side effects on the vaccine?
No, I haven't really seen much about that. I know that these conference calls we'll be having weekly will bring to light more information. I'm assuming that there'll be some information about that coming out, but I haven't really heard much yet.
One thing I heard is that one of them, and I'm not sure which one of them, your arm's you're pretty sore. It's kind of like if people had the shingles vaccination, the new shingles shot, you're sore, but it's too early to tell about many other side effects. But that one is, pain at the injection site is a side effect. It's going to be fairly common. So.
Okay.
Also, a question about is everyone getting them? Obviously, that's not known, but
No, how would you know?
And Chuck's question about, they're going to vaccinate. There's going to be people that have the disease that didn't know it, and they'll get vaccinated, and it shouldn't matter. But I guess we won't know that until we have a large number of people that are vaccinated. So time will tell. The initial studies, the biggest side effect is pain at the injection site, and other than that, they don't seem to be very many are very serious, or they wouldn't have approved it.
So how young will they be vaccinating, Dustin? In other words, what's the bottom age group look like?
That's a good question. I haven't actually heard that, but as far as I know, there isn't an age limit. I haven't heard them say they're only going to do over a certain age, but that's something I can ask the state.
Yeah, if somebody shows up with a bunch of kids, I think we need to know.
Yeah.
And that may take a while to come out. That may take a while for them to figure out what a lot of childhood vaccinations, they don't start them. Some are early, some they're not till 2 years old. And it's going to take a while to figure that out, I'll bet.
Okay. Other comments?
Yeah, with the first couple phases, it shouldn't really affect the kids anyway, because, it's just going to be healthcare workers and long-term care residents. So, yeah, I think Mark is right. We'll just have to wait and see.
another question on the difference in the vaccine versus one being an RNA and another one being DNA based, I think. Yeah, answer that.
So there was a public question about, is one an RNA based and the other DNA based, or does anybody know?
The Pfizer vaccine is actually an mRNA based, and I'm not sure about Moderna's vaccine. I think it's a DNA vaccine because it doesn't need to be kept so cold, but I don't know that for sure. And honestly, it's really what you're looking for is the end result of immunity. So I'm not sure it's really that important as to which one you get, as long as they do what they're supposed to do. But that's why Pfizer's is so, the mRNA is extremely unstable, and that's why it has to be so cold.
Yeah, it's saying Moderna is an RNA-based vaccine.
They're both RNA vaccines. I thought that was the case, but one's an mRNA, and I can go into the molecular biology of that, but mRNA is even more unstable than RNA. So.
Scott.
Do either of you know which vaccine is going to be distributed here locally?
The Moderna. It'll be the Moderna. The Pfizer vaccine is only going, this is what I read in the Missoulian today, it's just going to the biggest hospitals in the state because it has to be used in such large lots. And so we don't have enough people to use up all the vaccine in time. You have to thaw it basically, and by the time it's all, we don't have enough people to use up the lot that they have to thaw all at once. So we're going to be getting the Moderna vaccine.
Yeah, the Pfizer vaccine comes in batches of 700 or 975. So it just comes in a box of 975 doses. So the Moderna comes in batches of 100. So it'll be a lot easier for us to use it. And we can keep it at normal freezer temperature too. So it doesn't have to all be used at once.
I got a question for Maria. Maria, is the hospital going to make vaccinations mandatory for all staff at the hospital?
She's still on.
Scott, that is a really good question. We will not make it absolutely mandatory at this time, but we will do a lot of education with our staff, answer questions, have Dr. Ryder available, to answer questions for people. And I think with education, we will get, near 100% compliance on the vaccination. But no, at this point, we're not going to absolutely mandate it.
Okay.
Other questions of Dustin? Thank you, Dustin. Time to move into the County Board of Health updates, recommendations. Dr. Ransford's on.
This was supposed to start at 10:05.
I actually talked to Jackie this morning, and I guess there's a couple more cases. We actually, or Jackie thought we were at 10 because there's a couple of cases that Jen has. Jen has that Debbie's doing most of the contact tracing, but she's assigning some of it, and so. I think there's a little bit of confusion about the numbers, but as far as Jackie knows, we have 10 active cases. Okay. So, which is great. That's down from where we've been. And, as Dustin said, we're just going to wait and see if things get worse after Thanksgiving here. So, I talked to Christina this morning about the basketball season, and, it looks like we'll probably go with 6 spectators per team member, per team participant. So we're going to strongly encourage everyone to use masks, if nothing else, so that we can so the kids can play the entire season, so they don't have to get it interrupted halfway through. We're hoping everyone will really step up and wear masks to all the events and follow all the guidelines so that our students stay healthy and our basketball players stay healthy and the schools stay open and the sports get to happen. Other than that, I don't really have anything
I
else.
put the boots on.
So if they, like on these basketball games, if more people showed up and wear masks, they'd probably be able to go in.
Well, the more compliance you have, the less disease spread you have. And I mean, the number is still going to be, Debbie actually wanted it to be or Leanne wanted it to be more like 2 to 4. But even with, the Drummond gym holds 800 people, and at 25% capacity, that's 200 people. And we don't have that many, the basketball teams aren't that big. And there's not going to be any away visitors at the games. Only the home team can have spectators. So we should be able to keep that within the guidelines.
Who's making those decisions?
The conference.
The high school association, the Montana High School Association, MHSA.
Okay, so one of the things we wanted to do is introduce our newest member of the County Board of Health, Jeremy Al. Jeremy, why don't you turn around?
In January, though.
Yeah, it's in January, but this would be right here. Give us a little background and introduce yourself, please.
Yes, good morning, everybody. My name is Jeremy All. I am a current medical student, actually, with the Washington State University College of Medicine. And, I have been in Granite County about 6 years or so. I own land out on Rock Creek. I have interest and am training in rural primary care. That is where the tract of my college education is, and that is where I'll be going. My intentions are, of course, to return back here, but of course that'll be another 4 or 5 years probably until that time really comes where I start making those decisions. So that's just, I guess, a little short background of mine. Are there any specific questions, I guess, that anyone has for me?
Well, I want to thank you. It's not a question. I just want to thank you for stepping up and taking this over. So,
Certainly.
I think you'll learn something, and if you need any help from me, I'll be available. So
certainly, and I'm very glad to be coming in on the very on the end of my education here. That I don't have a lot of experience. I have a lot of hours in clinic going through medical school. We do 10 to 12,000 hours of clinic experience, and I'm coming to the tail end of that. However, what I am very educational rich of having a lot of the very current, what's being taught in school today, not what was being taught in school 20 years ago. What, I'm very rich in that. I do lack in experience of having been out working for many, many years. And that's something like for Dr. Ransford and some of the others that you do have more clinic experience, though the education years may have long passed. So, I hope that this will be able to be a very strong union, I guess, of new education and good experience as well.
Thank you. Thank you.
I should say one more thing, Jeremy. Go Cougs.
I second that.
I was going to say, Dr. Ransford, I think you'll agree, is I don't care how long Jeremy practices, he'll never have his hand up as many asses of the patients as you do. You got him beat, buddy.
I would hope not. Yeah.
Okay, so anything further from the County Board of Health recommendations, Dr. Ransford? Any public questions?
I got a question for Jeremy. Jeremy, I'm curious if you could tell us why you choose not to wear a mask.
Certainly, I can. And is everyone able to hear me okay if I speak from here?
Yeah, just speak up.
Mic here. Yes, I do choose to not wear a mask, and I do it quite consciously. So there are a few reasons for that. And that is about a three-part answer. Very first part is the question of what is the coronavirus and what is COVID-19. And in my education, my experience, and what I understand of this is that this is not indeed a world-ending plague. This is not, in fact, actually quite a fantastical illness. Yes, there are people who may be more sensitive to it, but this is one. Let me come at this a little bit different. So there are a collection of symptoms that we define into a disease. So the common cold, for example, there are a dozen different organisms that cause the collection of symptoms that we describe as the common cold. There are many different types of viruses that all go into this group that cause a collection of symptoms that we describe as influenza. Influenza A, influenza B, there's a whole laundry list of them. And COVID is remarkably similar in its classification for all of the different symptoms and signs that it causes as a cold and a flu. There are many questions that I have as to when did we cure pneumonia and when did we cure influenza, that we haven't had many of these things for 6 to 9 months now. And in my own estimation, and what I see in clinic and what I see is that this is another type of a flu. Are there individuals who may be more susceptible? Perhaps. And that's where they get their own individual choice of how they go about the business. So that's part one. Is this a tremendously deadly Ebola kind of virus where if you get it, you're going to die? Is this the likely? Answers? No. No, it's not. The second part of this is the effectiveness of wearing a mask in public.
Jeremy, hold it up a little closer.
Yes.
Yep, sorry. Yeah, it's not that good a mark. Yeah, that's better. Thanks.
Okay. And part two, of course, is, well, what is the effectiveness of a mask? And what I'm very thrilled about with my education is that we spend quite a lot of time reading and understanding medical literature. That, that's what I do for most of my days, is read through these 30 and 40 and 1,500 page reports and try and understand it and dissect down exactly what's going on and what is being spread across the news, what is being touted about by a lot of the politicians and officials all over is, oh, well, they are massively effective. They're great effective things, but they never say what they're effective at. And when we start going into the studies being cited, one of the greatest ones coming out of the Netherlands, that's one of the only randomized controlled trials of doing masks with the specific, the SARS-CoV-2 coronavirus that we're all discussing. And out of that comes an absolute effectiveness of about 0.2% in decrease of infection. Well, 0.2% is not, of course, a lot, but the argument is, well, if everybody wears it all the way across the entire population, that 0.2% is then maximized across the population, then you have a reduction. But what they don't talk about are the increases of infection. They don't talk about having an increased CO2. In fact, one of my classmates is doing his doctoral thesis. So with our school, we do research projects, we do a thesis, and his thesis is on the increase of cancer risk because of the increased hypoxemia, having greater CO2 in your blood and not as much oxygen. And we're also discussing the humidity of, constantly fidgeting with your mask, always, having, bacteria and germs getting stuck on the mask. And now you're constantly breathing, you're collecting all of that moisture from your breath onto the mask. And every recommendation that talks about why you wear a mask is, oh, well, it can reduce an infection. And all of these things are done in absolute perfect laboratory conditions where you put a mask up against a little suction cup and you have, what the ideal laboratory conditions are. Very few actually look at realistic use.
A little closer.
Well, just about easy.
I'll turn the speaker.
Okay, thank you. And that is where, of course, one of my greatest concerns is actually, well, what are all of the downsides of wearing a mask? There may be some upsides, but there are many more downsides, in my opinion. This also doesn't go to say that the vast majority of individuals who have the coronavirus, who are infected with that, are asymptomatic. Half the people who are symptomatic felt like they had a down day. So it's a risk versus benefit. And as I read the literature, as I understand the studies, as I read them myself from the original documents, not what does CNN say, what does Fox News say, what does some online blogs say, what does someone else say about the studies. I read them myself. And what I understand, what I see is that the risk does not outweigh the benefit. And it's not something that I choose to participate in.
Okay, well, thank you for the lecture. So,
you asked the question.
Yeah.
You ask the question, you want the answer.
No, I think it's important for somebody who's joining the Board of Health to make that quite clear, and you've done that. Thank you.
I just want to interject one thing. Jeremy, I respectfully disagree with pretty much everything you said. So that's not what I'm reading and not what I'm seeing. And so I still think mask wearing is very important.
I just have one thing to say with that, Mark, is that Peaburg are going to see a Board of Health member not wear a mask. So Peaburg's going to, people in Peaburg are not going to wear a mask. So you're going to see the cases are going to rise here real quick because we have one board member that refuses, or I won't say refuse, but will not wear a mask. Now they're going to see this and they're going to be like, well, we don't need to wear masks, so the whole town's not going to wear it.
Yeah, but how do you say what qualifies you to say that it's going to go up because they don't see a board member not wearing a mask? I mean, that's just conjecture. You pulled that right out of your bathroom. You didn't get it anywhere in any. These are two professionals debating the use of a mask, but you can't just say, "Oh, it's going to rise." You have nothing to base that on. Nothing.
It's, I just think that it is important that the people at the top, that the leaders, set a good example. So that's yeah, you can't say by this happening, this is going to happen. This is medicine, but I still think it's important for our leaders to set a good example. So,
Personal choice.
Yeah, until you infect someone else.
So I'm going to read just a real quick little snippet. This is an article from the Association of American Physicians and Surgeons, and in November 19th, about 3 weeks ago or so, they published an article saying, now that we have our randomized controlled trials about masks, what changes will you do? And the very first article, the sentence of this is, after being rejected by 3 major journals, a randomized controlled trial completed by 4,862 participants has been published in the Annals of Internal Medicine. And this is the first realistic use for volunteer adults. Spend more than 3 hours per day outside their home without occupational mask use. And then, of course, their group were those that did. Now, this is a study that a lot of people will point to and say, well, this talks about the reduction of rates. And the study authors note that the 0.3% absolute decrease in total population infections, the results are also compatible with the 23% increase of infections due to the adverse effects of wearing a mask all day long, reducing the fresh air that you're breathing and not being able to exhale bacteria out of your lungs. That whenever we're talking about the benefits, we're never talking about the adverse effects, and it's not nothing. And as far as, if one person's not wearing, is everyone else going to stop wearing? Well, most of the politicians on the television, they don't wear it when they're talking. And, well, are we going to say that they're the fault? And I guess maybe some people do say that. But, just like Mom always told me growing up, if one of my friends jumps off a bridge, am I going to jump off with them? You know, I trust people to be very wise and intelligent people to make their own choices. And even if they make bad choices, that is still the founding principles that this country, the state, and this county all stand for is a personal liberty to make that choice for yourself. And if you make the wrong choice, that was your choice to make. That was your responsibility. And unfortunately, even if that is your consequences, to suffer. Now, if I end up getting ill, that would be my choice and that would be my consequences to suffer. And of course, if there's ever a sign that any business should have, I mean, how long have we said this? If you're sick, stay home.
But Jeremy, what if you're asymptomatic and you don't know you're sick?
Well, that's almost everybody.
And you're asymptomatic before you're sick. The idea of wearing a mask is to prevent the spread of disease. It doesn't. That's the idea is to be altruistic and to prevent you from getting other people sick. So you can go around and you can have the right to not wear a mask, but I don't think you have the right to potentially make other people ill. It's just like if you own property, people next to you don't have the right to put a gravel pit in right next door or deface the property because it devalues your property as well. So it's, to me, in a public health issue, it's more than it's my right to not wear a mask. It's my right to not be infected by someone else when it could possibly have been prevented. So that's where I come from.
Then wear a mask.
And my argument is the effectiveness of masks are very little, if not to null. That within every bit of research, every bit of study that is ever done on this, what we don't talk about are the consequences of those. And, you know, just the size of the coronavirus itself can go tenfold hand in hand to a small spore of a perfectly quality controlled N95 mask. The N95 mask is a 300 micron pore. And that's wearing, of course, with full proper fit tested, be snugged up, not just 2 layers of cotton on your face where every time you breathe, you fog up your glasses. So to say that, of course, that is absolutely effective, that goes beyond what I would even call common sense of if the smallest pores of the most effective masks are 10 times wider or 3 times wider for a fully mature period, then that's just unlike, does it stop droplets? Yes, I think there's an argument for that. But this is not a droplet only kind of a thing. And just by sheer size, it can't be. But this is, of course, just the question of an N95. And who wears an N95 perfectly well fitted all the time? Nobody.
Well, no one's ever said that mask wearing was 100% effective. They've said from the very beginning that it helps. It can potentially help.
So does washing your hands. Now, washing my hands, I do. It's not 100% effective for a mask, but what it can do for some people, and if you are particularly sensitive, if you have cancer, if you have HIV, if you have AIDS, yes, sure, take your extra precautions. But as for the rest of the world, what we don't talk about is the significant psychological damage and injuries that people are suffering, where we're talking about, you know, a couple of hundred people within the state have died from allegedly coronavirus, if we want to trust every single report, which of course for 6 months or more now on our side of things, the medical side of things, where people, all of the physicians are being encouraged to diagnose as COVID-19. If you died of pneumonia and then posthumously you tested positive for a coronavirus, well, then you were at a coronavirus test. So if we include all of the inflated numbers in the hundreds, well, how many people have died of suicide? How many people died of a heart attack because they were too afraid to go? And my father right now, in fact, this is quite a personal story. My father had a stroke this summer. He had bladder cancer in June. He had a recurrence of bladder cancer in July. In August, he had a stroke. He's now in a nursing home. and he is unable to go and have a bladder cancer scan. He can't have a cystoscopy right now. 6 months after he had 2 bouts of bladder cancer because of coronavirus. Wow. So whether he dies tomorrow of coronavirus or he dies in a month from now because of metastasized bladder cancer into his spine, well, how many people are like him? This is one person living my life. How many people are dying because they are too scared to go out into the hospital? How many hospital and doctor visits are being declined? How many cardiologists are doing reduced numbers of visits for people with coronary heart disease? How many of those people are we going to count? Not to mention just people who lost insurance because they went out of work because all of the businesses were encouraged to shut their doors. And those are the things that we aren't discussing. That is another reason why I choose to not wear a mask, because this is not something to be fearful of. This is not something to be fearful of, as we aren't fearful of cold and flu season typically. We aren't fearful of bronchitis. We aren't fearful of croup. If you're sick, stay home. Wash your hands. If you are particularly vulnerable, stay home. But as for the vast majority of people, the psychological distress, I make the case, is far worse and far more detrimental than anything that we have discussed over the last 40 minutes.
Okay, well, this is an interesting debate between two professionals. Is there any other discussion?
Yeah, there was another question there. Let's see. There was a question if Jeremy's information was going to be added to the county website. I said it would. And the comment said that one death was a person who returned to Granite County from out of state with other problems. Bottom line, will mask wearing be enforced in Granite County by whom? Beth.
That's a back to the same one questions before.
Okay, other questions or comments? I'll tell you what, I think this whole thing is important because we're learning a lot. And hopefully this will all be mute because of the vaccine. But during, time after that, we can sit down and see what we learned.
I think Carl Sundstrom was trying to say something.
Carl, were you trying to say something? Carl, you got to take yourself off of mute.
Okay. Am I all right now?
Yes, sir.
Just a suggestion. When, I have this fear when the public, I don't think is really going to the CDC website, but would it be advisable if Marie could publish in the paper, they have that big whole sheet about what's available through telemedicine, et cetera, about who is eligible in the various phases for getting the shot, so we don't have a herd effect of everybody coming up to our little critical access hospital to get an injection. So I think it'd be helpful if we did our, the phases and when the general public would be eligible after the essential workers got injected.
Excellent recommendation. We'll talk to Scott with the news, and we'll talk to Maria. So good job, Carl.
Thank you. Thank you for the help.
Anything else?
Exactly what I was thinking about doing.
Okay, so he's on it, but that was a good suggestion. Okay, so Jeremy, thank you very much for coming back, and I enjoyed the discussion. Is there any other Board of Health information, questions? Okay, hearing none, we're going to move on here in a minute to the next agenda item. Thanks, everybody, for joining us on this. Thanks, Dustin. Our next item is at 11 o'clock.
Thank you. You guys have a good day.
And so they went ahead and they muted the mics again. Unbelievable. I want his information.